Dr. Nazari, back with Dr. Nazari of Houston, Texas, in his 2 offices. Dr. Nazari, are you in one or both of your offices doing also orthodontic works, the braces?
Yes, we do have orthodontists and staff who does orthodontic treatment of braces for children and adult, both offices.
So you do orthodontics for children and for adult, and we're going to talk about the adult orthodontics in a different section. But tell us now, there's a lots of there are braces, there are clear braces, there are Invisalign, there's all this type of stuff out. Can you break them down and tell us a little bit which one is what and why one is used for certain reasons and why one shouldn't be used and and that type of stuff?
Well, in growing children, that we call it mixed dentition, the best treatment for them would be traditional braces, which are the metal braces or clear brackets, not clear braces. People sometimes they confuse the clear braces with Invisalign. Invisalign are just like clear trays that the patients would place in their mouth. But the clear braces are the brackets. They are just clear. They're made of ceramic, so they are not as visible as the traditional silver braces. In mixed dentition, or the patients anywhere between the age of 8 to 12 that they have both permanent and also primary or baby or deciduous teeth in their mouth, we recommend that they get the traditional braces with the wire and also the brackets. After you have all your permanent teeth in, and then now these days we have what is called teen Invisaligns or Invisalign for teens that can be used for them. Again, these are all selected cases that they need to be evaluated by the orthodontist or experienced general dentist who have done braces for a while, for a long time. And both of them just work great. There is the outcome. There is not much difference between the outcome, one technique versus another.
I see. So why would it be that the young growing children would be better off with the traditional braces? And of course, the traditional braces these days are most already on the clear braces, on the ceramic. Basically, they're not quite as heavy and visible as the old metal braces, but still they are more visible than the Invisalign, I suppose, yes?
Yes.
Yeah, so anyway, why would a child, a growing teenager, be on an average better off with the braces rather than with the Invisalign?
Well, when you have an Invisalign, it covers the whole surfaces of the teeth, both upper and lower, and then we want to make sure the patient gets grown fully. In the future, I'm sure with the Invisalign techniques, there is going to be some techniques available in the future. Probably we can use them in kids that they have mixed dentition, which I mentioned earlier, both permanent and also primary teeth. But today, we don't have that technique available. We use Invisalign on teens that they have all fully erupted permanent teeth in their mouth.
I see.
We want to make sure that, one of the reasons is that we want to make sure that, the patient gets complete growth of their teeth, because Invisalign covers all the surfaces of the teeth and that might interfere with the growing of the jaw and also growing of the teeth which are trying to come to the surface to the same level of the other teeth.
I see. So basically what you're saying here, what you're saying here is that if a child has still his first teeth in it, and already some second ones, and needs, based on the dentist, orthodontic adjustment in order to have the teeth growing straight, he simply got to have the regular braces, because otherwise the mixture of the two teeth doesn't fit with the Invisalign tray, which is kind of like a mouth guard, roughly put, I guess, right? And however, when all the teeth are present, let's say age 15 or 16 or whatever, whenever that is happening, or 14, then the tray, the Invisalign, could possibly be used.
Yes.
Okay. Is the Invisalign a little bit easier to use for the patient? Is it less dental visits, less less time involved or something like that? Is there any advantage for him in that area?
Yes, there are the patients who are candidate for Invisalign. They have less visits coming to the dental office, and also it's more acceptable to the patients because they don't have to deal with wires and brackets in their mouth.
Okay.
And
all
also
right.
it's easier for them to clean the teeth, brush and floss between the teeth.
Okay. All right. Good. Wonderful. And I guess for adults, it's the same thing. Adults in this case could possibly be wearing Invisaligns, right?
Yes.
So that may be rather advantageous to some adults who, a little self-conscious, maybe wanting to wear braces at that age, going for a job interview, having that date or whatever it is. Of course, that doesn't mean 15 and 16 years might not have that same concern very much so. So let me ask you, are those Invisalign braces really invisible? Can you really not see them?
Well, you can see them, but from far distance, within a couple of feet that you're talking to the patients, they're not very, very noticeable unless you zoom into the patient's mouth, and you can notice those. And again, Invisalign is much, much more aesthetic and cosmetically acceptable to the patients than traditional braces or even clears or ceramic braces. Okay. But again, you need to be evaluated by your dentist or orthodontist to make sure that you are a good candidate for Invisalign.
Okay. All right. And Invisalign have an advantage apparently of you must actually take them off during eating. So after eating you can brush and floss like you would be doing with your regular teeth, and thus no spinach gets stuck between the wire. Is that kind of an advantage also?
Yes, it's easier to brush and floss. It's just like your own teeth, you brush and floss. With the traditional braces, it takes some time and some patience to clean out the spinach or broccoli from the teeth or from the braces and wires.
Good, and that must be good because if one has problem, again, if one is a little bit on the lazy side in brushing and etc. and flossing over a 2-year period or 1.5-year period while those brackets are on it. There could be some danger to the gums by not brushing and flossing the way one should, and one doesn't do it because one has the braces on it, right?
Yes, absolutely. Absolutely. Not only to the gum, also to the teeth also. There is this condition called white spots that we encounter on daily basis with patients who do not brush and floss and don't follow proper oral hygiene. You see these white spots that they end up becoming tooth decay or cavities over time around the brackets, around the gum line of on the teeth surfaces, which is very, very unaesthetic, and later on becomes big cavity and decays, and then decreases the longevity of the teeth just where the decay is occurring, right at the neck of the teeth.
Mm-hmm, mm-hmm. So obviously if one wears braces with the wires and stuff, one really got to be disciplined, BHD kind of like big-headed discipline in order to make sure it all comes out okay, right?
Yes, I agree with you.
Good. Well, all right. That's it for the braces. The 2 different type of braces. I think that's very informative what you taught us here. Thanks a lot.
Thank you, sir.